ASMR sprained finger roleplay realistic medical exam. Hello there, come on in and have a seat right here. I hear you've had a little accident and hurt your finger. Well, don't you worry, you're in very good hands. I'm Dr. Ness, and I'm just going to take a gentle look and see how we can get you feeling better. So just try and relax for me. Can you start by telling me about what happened? How did you injure it? I see a sports injury. Those are very common. Was it from a direct hit, or did it get bent backwards? Okay, thank you for clarifying. And on a scale from 1 to 10, with 10 being absolute worst, what would you say the pain is right now? Alright, let me just make a few notes here. First things first, I'm just going to get some basic vitals. It's just for our standard procedure. Gotta see your other wrist for a moment. I'm just going to check your pulse. Okay, just let your arm relax for me. Everything sounds perfectly normal there. Good, now let's focus on that hand. I'm going to put on some gloves so you might hear a little crinkling sound. Alright, now you can show me which finger is bothering you. Just point to it for me, okay? I can see some mild swelling and a little bit of bruising right around the middle joint. The very first thing I want to do is just look. I'm going to gently hold your hand and compare the injured finger to the same one on your other hand, just to see the difference. Yes, I can definitely see it. The swelling is noticeable, but I don't see any obvious deformity, which is a very good sign. Okay, now I'm going to very gently touch the area we call this palpation, and it just helps me find the exact source of the tenderness. Just let me know if you feel any sharp pain, okay? I'll be incredibly gentle. Okay, right about here, a little tender. I understand. We'll be mindful of that spot. It seems like discomfort is focused around the ligament on the side of that joint. Okay, as far as it's willing to go, that's perfectly fine. Don't push it past that point. Now can you try and straighten it out? A little stiff, I see. That's completely normal with a sprain. Now let's test sensation. I have two little tools here. One is soft and this one feels a little sharp. But I promise it won't hurt you. I just need you to close your eyes and tell me if you feel soft or sharp. Ready? Sharp. Good. And this? Soft. Perfect. Your sensation seems to be completely normal. So based on my examination, swelling that specific point of tenderness and the limited range of motion, it appears you have a mild to moderate finger sprain. A sprain is an injury to the ligaments, which are the strong little bands of tissue that connects your bones together. In a more severe case, we might order an x-ray just to be certain there isn't a fracture. But based on your symptoms, a sprain is definitely the most likely diagnosis. The best way to treat this is with something we call the RICE method. It stands for rest, ice, compression and elevation. Rest is simple. Just try not to use that finger too much for the next few days. Ice will really help with the swelling. Just use a cold pack for about 15 minutes at a time, a few times throughout the day. And elevation just means trying to keep your hand raised above your heart when you can, which also helps bring down the swelling. For the compression part, we're going to use a technique called buddy tapping. This is where we tap the injured finger to its healthy neighbour, which acts as a neutral splint and gives it support while it heals. I have a little piece of soft gauze right here that I'll place between your fingers just to stop any skin irritation. Now I'm just going to gently wrap the tape around both fingers once above the elbow, the injured point. This won't be too tight at all. There, how does that feel? Not squeezing too much, good. Just let me just press on your fingernail for a second and the colour comes right back. That tells me your circulation is perfect. You'll want to keep this on for a few days. You can change the tape daily, especially after you shower, just to keep the area nice and clean. I'm just going to jot down these instructions for you, so you don't have to remember all this. If you find that detailed checkups like this are helpful or relaxing, you can always subscribe to make sure you don't miss your next appointment. A sprain like this should heal up within a few weeks. Once the pain and swelling go down, you can start some gentle movement exercises to get your flexibility back. However, and this is important, if you notice the pain is getting worse or you feel any numbness or see a significant colour change in the finger, I need you to come back and see me right away. But for now, I think you're all set. You did wonderfully. Just take it easy for a few days and let your body do its work.